I tried the background, but I don't like how it looks. I also had to flip myself, so I'm like mirrored. So I'm gonna figure out how to get rid of it now.
It doesn't look bad though, Audrey.
It doesn't. Yeah, it doesn't look like I can see
You know, it's the Academy of Hope, but yeah, like you know, it's the Academy of Hope. It doesn't look bad.
I feel like
really?
it's not for me. I'm gonna take it off. I'm gonna work on it.
Yeah.
That's that perfectionist that we all have, right? It's got to be right.
Let me get my virtual background going as well. I thought mine was already applied.
Hi, Derek. Nice to meet you.
Nice to meet you too. Glad I could be a part of it.
Yes.
Audrey, you're giving us vacation vibes now.
Yeah.
So now I have to figure out how to not have a background.
That's why I said mine is still here, because I couldn't figure out how to.
All right, here, we're back to the house. We're not at the beach anymore.
Anybody think you're just not doing anything, right?
And Dirk, Sabrina, I think will control the slide. So we'll just
Wonderful.
go to the next slide.
Sure, and I've taken some notes for my slides as well, so I should be pretty prepared.
Okay.
It'll be good to keep yourself on mute if you're not talking, so they'll limit any background noise. Thanks.
Hello, everyone. Thank you for joining our monthly meeting. We will start shortly. Just give a few more people time to sign in. Okay, we're going to get started here. Again, thank you for joining our monthly meeting. We just want to remind everyone that this is a webinar. You can see us, but we cannot see you. And we ask that you excuse any background noises as we still are working remotely. And at this time, I will turn it over to Yvette Banfield to open up the meeting.
Hi, good afternoon, everyone, and welcome. So delighted that you're able to spend the afternoon with us as we kick off CNHED's September monthly meeting. I'm delighted that you're joining us, and we're hoping that this will be an informative and engaging conversation, discussing a topic that's dear to my heart and is of particular interest to CNHED, which is workforce development, but particularly looking at it through the lens of healthcare. I will be the moderator for today's conversation. And for those who are joining CNHED for the first time and may not know who I am, Yvette Banfield, and I'm the Vice President of Economic Development Policy at CNHED. And if for those who are not familiar with CNHED, just to give you just a blurb, CNHED, we're a nonprofit membership association for advancing community development solutions that address the needs of low and moderate income residents in the District of Columbia. And we do this through convening, advocating, and educating diverse stakeholders and our members and diverse stakeholders. And so one of the areas that we focus on, as I mentioned before, is workforce development. We are serve as a community-based intermediary for organizations, workforce development organizations in the District of Columbia that are community-based, providing training and other services to district residents. And so one of the reasons why we're delighted also to talk about this particular topic today is also because Steve Baudet is also participates on the FY 2021 Healthcare Workforce Partnership, which we have Ruth Pollard, who will be giving a presentation specifically on some findings and recommendations related to a study that the Healthcare Partnership has recently completed. And so Steve is not here today, but I'm delighted to welcome Ruth Pollard, as well as our other panelists. Ruth Pollard is the Program Director of Healthcare of the DC Healthcare Workforce Partnership, which is an initiative convened by the DC Hospital Association, also known as DCHA. Ruth will share the findings and recommendations from the partnership's first annual healthcare occupations report for 2021. She will share what they've learned through this research, and she'll provide this report for the findings and the recommendations that she's going to be presenting, will provide direction for creating a talent pipeline for skilled district residents in the healthcare industry. And then also, I'd like to also introduce Veronica Wright. She is the Senior Vice President and Chief Program Officer for Workforce Development at Sun CET, and she's also a CNHED board member. For those who are not familiar with Sun CET, they offer free tuition adult workforce training programs that prepare adult learners for industry recognized certifications for careers in healthcare, as well as the building trades. And joining her is Dirk Keaton, and I know he works closely. And Dirk, because he's joining us as a backup for Veronica in the event that she might have to step away. Dirk, I'm so sorry. I don't have your title, so you'll have to, when you have the mic, you'll have to introduce yourself briefly. But Dirk is invaluable. He works with us, with our workforce intermediary, and as we convene the working group meetings monthly, and so he is indispensable in terms of his knowledge about the workforce system. And then lastly, we have Audrey Reese. Audrey is the Managing Director of Student Services at Academy of Hope Public Charter School. The charter school is a DC-based workforce development and adult education provider. The Academy of Hope provides a variety of programs and services that meet the needs of adult learners. They offer GED, they offer adult basic education for adult learners who are seeking to go to college. They also have a gateway to college and careers, and also career academies. And they will be talking about one of their career academies, which is related to healthcare, which is providing a CNA or program, as well as phlebotomy. So we're delighted to have Ruth, Veronica, and Dirk, and Audrey join us. And so to kick off this conversation, I'm going to pass the mic to Ruth, who's going to share the findings from the study that they recently completed. Thank you.
Right. Thank you, Yvette. I appreciate that, and pleasure to be here today with the CNHED team and to have see familiar faces and collaborators in this partnership. So I'm going to go ahead and share my screen. One share. Let me know if I'm going to go ahead and put it in presentation mode. Are you able to see the lead slide that says the Partnership and Annual Healthcare Occupations Report? Okay, great. So I have a full slide deck. I won't go through all of these slides. However, I created the full slide deck because I would like to share it with CNHED. I'll provide that so that you all can have a copy of the slide deck moving forward. So as Yvette said, we are the DC Healthcare Workforce Partnership, and we started in January of this year, 2021, really designed to bring together healthcare leaders, employers, core partners, and network supporters to focus on what we call part of the problem to solve. And we really frame it in that case, in that way, because we know that it is work that's being done, and how do we leverage the resources of partners like CNHED, like Academy of Hope, like some CDT, to ensure that we are creating for the healthcare industry an integrated system. And so that's what we're looking to do, and to really build this pipeline and of talented and skilled District of Columbia residents into the healthcare industry. And so you're probably very familiar with our very competitive labor market here in the District of Columbia. 50% of DC residents have college degrees. Yet over 70% of all DC jobs are held by non-DC residents. And then that's a fact that hopefully we can change, particularly in the healthcare industry. We also know that we have high turnover rates, especially in the healthcare field, with positions that are typically entry level positions, but also have opportunity to create pathways into healthcare. And that's really where we want to focus on addressing these challenges. Good news is that there are definitely lots of anticipation for the industry to grow, healthcare industry to grow, with healthcare entry and intermediate jobs really projected to grow by 37, and I think it's actually a little bit over that now. And we see that healthcare positions are changing, and the need for the additional growth in how we have skilled labor and trained employees in healthcare will be important. And one of the main reasons why it's very important for us to have the training and education group here today. as a part of the workforce. So the partnership itself is built on a next gen sector partnership, which really is about, again, how do we align? We're not trying to recreate the wheel, but how do we align the education, training, economic, and the workforce development systems together and ensure that we have agreement on the things that we should tackle as an industry, recognizing that those things and those needs will evolve. It is led by the industry, so it's led by the healthcare employers in terms of really saying, here are the issues of the business, of the industry, and then collaborating with core partners and network supporters, really develop and evaluate what are our goals and where do we need to focus on. The partnership is designed to be focused on workforce development, pipeline building, but also in terms of creating industry competitiveness, is being a part of the district, Maryland, and Northern Virginia region. We recognize that we have regional competition in terms of the healthcare industry, and how important it is to focus on making sure that the district's healthcare industry is very competitive and solid. If we apply that model to DC, this is basically what it looks like. Our sector is healthcare. Our subsectors are acute care services, hospitals, ambulatory and behavioral health services. So think federally qualified health centers, other types of behavioral health services, other types of any type of specialty care that's on an ambulatory basis, and nursing, residential, and long-term care services, including home health care. Our partners consist of the business leaders in these subsectors, healthcare employers, core partners like our educators, and network supporters who typically provide some type of supportive services. We're at over 40 partners. I want to say we're at over 45 partners now. And this really is who we are. This is how we define ourselves: an industry-driven community sector, community supported based partnership that focuses on healthcare with our core partners. And you see here how our core partners are described more than anything. And we mean that really intentionally, because we approach it in terms of there's one table. And in fact, we have Veronica actually is a part of several of our action teams, but we have one table in terms of the partnerships. It's just different levels of how you bring your expertise to the respective table. And then it's a list of our partners. It's getting long now. I'm probably going to have to create this into 2 pages, but this is a list of our partners: the conveners, DC Hospital Association Program Services Company, the public funders, the DC Workforce Investment Council, and then you have your acute care, your ambulatory, like Walker, Mary Center, McClendon Center, Unity, Volunteers of America, Kaiser just came on board, your nursing residential here, Carroll Manor, Bridgeport, Premier Health Services just joined us, Starter Baptist recently joined us. So we're really excited, of course, excited to have CNHED as a core partner, as well as some as a core partner here. Really, this shows how, in fact, we work together in terms of the convener and the intermediary, along with the public partner and program staff like myself, the partnership, and how they work together around creating, designing and creating the solutions that we want to advocate and champion for. So I am going to, I apologize, I'm going to move into the actual shared agenda in terms of our vision. These are our priority areas: healthcare as a career destination. So really to promote the industry as a whole as a first choice destination for district residents, really raise awareness about the healthcare industry, particularly as we're coming, through the height of the pandemic. While, we still wrestle with what's happening, healthcare industry is seeing lots of changes in how we deliver, right, healthcare, but also the perception of how difficult it is to get into the healthcare industry if you're not a nurse, a doctor, et cetera. And we really want to present the healthcare industry as one that is attractive for careers, and careers that create stackable skills that you can have pipeline and move and progressively move in the healthcare industry, regardless of the respective subsectors. The second piece is about the curriculum design and training. So we want to be sure, and employers really came forward in a very vulnerable way to say, do our job descriptions really align what we're asking for? Do they align with how our residents are being trained? And then respectively, the licensures that are required. So we have a focused goal around assessing the current curricular resources, not from a perspective of do they do what they do, but in perspective of alignment of the training, the licensure, and the job descriptions. Do they match? Are there gaps? What are ways that we can work to improve to ensure as our residents are trained that they're successful in these positions, because they're written to be focused on, if I need a certified nursing assistant, my job description is clear that I need a certified nursing assistant and doesn't expect an LPN level type of services if I'm asking for a certified nursing assistant. And then the last priority now is really building this career pathway system, really about understanding the lens of the experience of our healthcare workers, particularly in our 5 prioritized health care occupations, what the envisioned future of healthcare careers look like, and what are the existing career pathways, and how do we learn from all of those? Again, not trying to reinvent the wheel, duplicate work, but how do we learn from those and really stand up a system that brings together all of these programs? So part of our deliverable this year was to engage our partnership and others throughout the city to present an annual healthcare occupations report, which we did present to the DC Workforce Development in 2021. We conducted an analysis of the current and future trends and needs of the healthcare industry. We looked at career pathways. We looked at the various ways in the training programs, just to say, what exists, what's out there, and where are there opportunities, not in some kind of punitive way, but where are there opportunities for us to collaborate or to recommend where we might put other resources. And so we engaged in the quantitative analysis, and you see in this slide here, it shows the most in demand, and we're focused on non-degree occupations here, from nursing assistants to medical assistants to farm techs, surgical techs, the list goes on and on, dental assistants to health technologists, to really understand sort of what are these careers that are in demand, that have the job postings and can help create entryway into healthcare if we have the right training, and ensure that training allows stackable skills that allow our residents to move through the industry. Through a respective process, we identified the 5 prioritized healthcare occupations that require less than a bachelor's degree. They emerge as the certified nursing assistant, which can be called sort of different things. This is how we're calling it: certified nursing assistants, certified medical assistant, the home health aide, the licensed practical nurse, and the pharmacy tech. And so in the previous slide, we had over 10 or 15 occupations, which again, we will promote in the sense of great entryway for non-degree but certified types of positions. Our focus efforts, though, are on these 5 prioritized positions because of not only their job growth, but also they tend to have high turnover rates, but they're also affordable in terms of training and being able to the training time and the training cost. So it's where we the partnership landed for the 5 prioritized areas. So as we look at these prioritized areas, we start to also look at, what are the required skills and competencies and the respective barriers. And so you see here, we pulled to help understand, do we have identifying foundational academic skills, essential types of knowledge and skills, general cluster skills when we think about the therapeutic services, which is where all 5 of these positions align. And so we did the further research to understand what's required here, and what are in each of these respective skills or competencies or requirements. Then what other what are the other skills or building blocks that are necessary? And so you see in these next couple of slides there that we teased out each of these foundational, essential, cluster, and pathway knowledge skills. And some of the key things that we saw, right, was around things like communication, continue to show up in these respective skills, and recognize how important communication is in terms of the 5 prioritized positions, because they're often the ones who are right there on the front line: the CNA, the CMA, the home health aide, even the pharmacy tech are right there on the front line. The LPN may have entry points after a CNA or CMA, or in other subsectors could be right at the front line, particularly in the nursing, residential, and long-term care subsector. But communication is really important. So when we look at the job descriptions, when we look at the licensure requirements, and we look at the training, one of the things that we want to see is, are we educating and training, and then have an expectation for it to continue to support communication skills and how communication skills are built. The other thing we started to look at was the actual DC approved training locations. And we know there are many, many more training locations. We really wanted to look at affordable training education to really say, are these, and less of the programs that often are strictly private and their costs might be prohibitive for district residents, particularly district residents that are in communities that are lower resource types of communities. And so we looked at these 5, and you'll see here that we saw that there aren't a lot of farm tech trainers. Here UDC has the farm tech training, not a lot of training around, or training programs around the CMA, again, that are affordable and accessible to our DC residents, although we know that there are others that do exist, and we're hopeful to continue to expand this respective list. But it just helped inform, should we be putting more dollars? And again, from this asking the discovery questions, do we not have these types of training programs and locations because there's not capacity? Training programs don't have persons who are willing to train, because what are the barriers and the challenges that they have, and how do we help in the partnership to advocate for the respective resources? And so, Yvette, I just wanted to confirm, we're fielding questions at the end, right?
Yes, that's correct.
Okay. Let's saw some questions pop up. And so if you see me pause, I just saw some questions pop up in the chat and the Q&A. So in terms of looking at, we also looked at what are the validated and recognized education, certification, and training and licensure that are most in demand. And here again, patient care technician, LPN in terms of these recognized certification. And then we looked at things like the BLS, the basic life support certification in cardiopulmonary resuscitation, CPR, EMTs. And so, looking at what these respective national most in-demand certifications are, even as you think about the positions that we have. And we looked at what would be the return on investment. And, there are some concerns. I mean, there are some concerns as we look at these 5 prioritized positions, right? They have lots of job descriptions, high growth and high demand, but do they really have sustainable, livable wages, right, for our district residents to be able to start moving into that, being able to have sustainability for their families? And so, again, as we look at the range of tuition, you see here the LPN, the CMA, the CNA, have the highest cost, the LPN, a high cost in turn, a high return on investment, because the LPN particularly can go in the industry with a higher median yearly salary, as well as there are often bridge programs for LPN occupations or positions. The farm tech, which has, I'm sure if you've I see it every day at this, CVS, Walgreens, that, need part-time, full-time pharmacy technicians. They're very low cost in terms of tuition and fees, often on the job training, but the association does offer training requirements for pharmacy tech. And then of course the Department of Health and the Pharmacy Board has a process for the respective application to become a pharmacy tech and licensure in the District of Columbia, but they are coming in at 46,240 for, again, medium. And we want to be really clear to show this in terms of DC and not on a national level, because we know the cost of living, right, is very different in the District of Columbia. The certified medical assistant and nurse assistant, let's say on the high end, 18,000 in terms of tuition and fees, but can net 45 and 36 respectively. What really causes concern is that the home health aide, again, lots of job descriptions, particularly job growth in the subsector of nursing, residential, and long-term care in low cost to get training. They do have a requirement to pay a fee to the Department of Health Board of, I want to say it's nursing, for the respective licensure, but the median yearly salary is 31,000. So that really says that half above and half below are making their less. Those that are making less than 31,000, which can arguably be said not to be a sustainable wage in the District of Columbia in particular. And so then we pulled in and started looking at, again, the licensure boards here and what are the minimum requirements for each of the respective area. And as you see here, minimum age, and then you see 125 hours, 65 classroom hours. This certified nursing aide applies to the CNA role that we identified. Then you look at here, certified medical assistant, 760 hours. And again, going back to, okay, well, how much how much are they going to, net on that? We really looked at that when we started thinking about our recommendations, 760 hours, the fees, et cetera, all of which require criminal background checks, which could be a barrier to persons who have been just as involved or returning citizens. And so licensed practical nurse, 70 credit hours over 24 months, 400 hours for the farm tech. Again, home health, which is very much on par with the certified nursing assistant, and can have bridge programs. We need to be sure that that is aligned, and that's what we're hearing from the industry executives, is that we need to make sure training programs allow those stackable skills that can be transferred, so that home health aide can move into a certified nursing assistant position, because they have as you see here, very similar training, though the certified nursing aide often has a higher salary range upon entry into the workforce. And then here we really show just our career pathway map. So we took the 5 prioritized occupations and it just started to really show where their pathways could be, right, based on how they're trained and what the stackable and transferable skills could be. Bridge programs. So if you look at, for example, the ones with the stars are our 5 prioritized area. You look at the home health aid here, may go over to environmental services and then make the trajectory up this way based on additional training and education. The certified nursing aid, again, you see, $6,000-7,000 difference in terms of annually, clearly above the minimum wage and for the certified nursing assistant. And the certified nursing assistant has several pathways here to be able to go to medical assistant if that's an interest, but also ENT, lots of bridge programs to CNA and the licensed practical nurse, but also the certified nursing assistant, if so chooses, becomes a certified medical assistant, can have a pathway up the lab and medical clinical technician, which recall on that slide where we saw those in-demand careers. These careers here, medical radiological technologists, MR technologists, are careers that are going to continue to have growth and continue to have sustainable wages as we look at the health care field. When we think about, again, the licensed practical nurse, lots of opportunities for the licensed practical nurse. Surgical technician was on that list, and you see the clearly, you know, just a major jump from 36,000 going to additional education to be able to move to CMA, perhaps an EMT if that's the direction, but you could do CMA straight to LPN to a surgical tech, and then you start to get in a different level of salary, which also LPNs have programs to go into the RN and the BS in. The pharmacy tech was more of a straight linear. They typically stay in their area. They go from pharmacy tech and then move in various types of certifications. And so you see here, Pharm Tech, certified, advanced, certified, and then certified compound sterile preparation tech. And you can see here that the salary doesn't change a lot because they're staying within the field. However, this is sort of what their pathways typically are, unless they go to the pathway of a pharmacist here, which you know requires additional education. So this is where we landed, and these, in terms of our recommendations, again, you'll get a copy of this, but we really landed on, you know, prioritizing these 5 health occupations in terms of investments for the industry, the respective to the subsectors, really supporting the healthcare workforce partnership to make sure that, again, we are integrated, we're not being duplicative, but we're bringing together to be more, you know, systems approach, strengthen the education and training, so really support the work and champion funding for tuition-free programs or reduced programs, help support increased training capacity, so you'll be able to expand the capacity of trainers like some, and create equitable and flexible training accessibility. So we heard from residents to say, you know, I need a hybrid. I have a family, I'm trying to work too, so I need a hybrid, can't necessarily stop working and go to school. Career pathway system really talked about, you know, investing in and corralling our funding to really support this really equitable and inclusive talent pipeline. And then, of course, advocacy and public-private engagement. We want to make sure we are championing what needs to happen as we look at policies that might be barriers to employment, as we look at policies that might be barriers to, you know, education and training organizations. And so we want to make sure that we are on the forefront of being a collective voice as we respect that each subsector has their respective associations, and then, you know, drilling down to each employer and partner have their respective strategies and strategic advocacy. We want to be able to bring those voices together collectively around the industry issues. And so I will stop there. That is the end of my presentation. And again, happy to take questions, whether we do it however, Yvette, you decide we're going to do it. I'm here until the end.
Great, thank you. That was excellent and very informative. I see the questions that were popping up in the chat. If you have additional questions, please put them in, and we're going to try our best to get to them all. So what I'd like to do is turn it over to Veronica Wright, who's going to give a presentation on some CET's healthcare program.
Thank you, Yvette. Good afternoon, everyone. We'll kick the presentation up here. So while the presentation is coming up, again, I am Veronica Wright. I am the Senior Vice President, Chief Program Officer for the SUM Center for Employment Training. And joining me in my presentation, as Yvette mentioned, is Dirk Keaton. And Dirk Keaton is our Data and Curriculum Manager. And so I would say, you know, Ruth had a great setup for the segue into the work that we do. I would say the CET, I think when Ruth sort of started her presentation, she sort of mentioned like what's, you know, a problem, right? I like to think of, you know, our program as part of the solution to a problem that we're working on is being solved. So you could go to the next slide. And so just a little bit of background on the organization, SUM itself. I think many may know of our parent organization as So Others Might Eat, and some of the work that we do, and then help shape up sort of the school portion of it. So the organization itself offers what I would call a comprehensive continuum of care that meet both immediate and long-term needs for anyone experiencing homelessness or poverty in the district. And some of the services that we offer under that umbrella, it would be our emergency services. And so in our emergency services, folks can go get a meal a couple times a day, shower, change your clothes, things of that nature. We also have out of West Virginia, our addictions and treatment, and we have a residential treatment program where folks might go out to the mountains for about 90 days and transition back into DC in a transition program. Also under the umbrella of SUM, we also have what we call access to quality health care. So we have a full medical clinic, dental clinic, and mental health services, both at the O Street site and at the Conway Center, which is where the CET program is. And additionally, in the Conway Center, where I'm located, we have what we call in the continuum housing. So I would call that safe and dignified, affordable housing. And so where CET comes in, once you have met the immediate, needs of anyone experiencing homelessness or poverty, my program is looked at as part of the continuum to helping one get back to earning a living wage. And I would say for CET, how we do it, where we do it in two skill sets, so building trades and in healthcare. And for purpose of a conversation today, I want to share with you, we're going to talk focus on the healthcare program, which we have. Okay. And so today, like I said, we'll do a quick overview of the program model, our enrollment requirements, thank you very much, and some of our partners and affiliations, and talk to you a little bit about outcomes and what that looks like. So,
Veronica, can you change to presentation mode so others can really see it clearly?
So Raina has it, I believe.
Okay.
Sorry. So while she's doing it, hopefully you all can still see the actual slides. So at any rate, the mission of the Center for Employment Training is what I wanted to share, is essentially to empower folks to move themselves out of poverty into a living wage career. And I think one of the sectors in terms of that I said I would like to focus on today, sharing the information on the healthcare. So within our healthcare track, the courses that we offer are medical administrative assistants, there's a medical assistant, and then also we have licensed a electronic health records course as well. And so you can see what the criteria is when we go, every so often we do a labor market study and we decide like, hey, is there job growth? Is there sort of upward mobility in the career pathways in which we chosen to train our participants? And as Ruth was sort of mentioning, you probably saw on some of her slides, it is absolutely a high demand and a high growth field. So our certified medical assistant program and the medical, I think all of them meet that criteria, I would say. And you can move to the next one. I'm still seeing the, I think it looks like I can still see 2 slides. So right now, I'm not sure if you can get it to the presenter mode.
Yeah, you should be able to click on those 3 dots, Raina, and it should go, you can say in presenter mode, high presenter view.
Yes.
And then go back to the presenter.
Thank you.
Okay. And I know in the interest of time, so I'll keep on talking. So the next slide we were going to go to would have been the program model. And so what does the program model look like and what does that look like in practice? Part of it is, how do we do what we do? I think, if you've gone to a course, it's a post-secondary course. You can go back just one, I think where the model was at. Yep, here, thank you. we do it holistically. What does that mean? I think oftentimes people say, oh, okay, well, we'll have a holistic approach to something. What does that mean and what does it look like in practice? What it looks like is, providing not just the job training where I have instructors who come from industry who's teaching this sort of the skill set, where the skill development, but as part of sort of the approach to what we do, it is like you add the basic education. I think oftentimes for some of the programs, most might be familiar with what we consider might be a CASAS assessment. I think many programs may have like about an 8th grade level where participants might come in. I would say that unfortunately, we're fortunate enough where participants, we assess them in at about the 4th to 6th grade level. And a little later on in the presentation, Mr. Keaton will give some sort of more context to sort of what the basic education looked like. But it's contextualized, it's a contextualized approach. So in our program, you might see my healthcare instructor teaching right alongside my math teacher. So they will co-facilitate and they will deliver the contents of, the medical assistant course contextually. So if you think about what might be something that a medical assistant need, math, right? And how does math show up in that job field, right? Might be to calculate dosage or something like that. So anything that ties those two things together, but the participants get to experience math, not from what a K through 12 environment, like when they were in K through 12, but more so, like I said, contextually where it's applicable to the things in the medical assistant field that they're learning. In addition to that, I would say one of the components that I think this is where, most that call them soft skills, we call them necessary skills around here. I think in working with employer partners, they, come to me often and they say, hey, well, someone with great technical skills, but is this person dependable, right? Can they be a team player? And that's where that career development portion comes in that. So what that looks like is our participants every week, part of the course, they're doing the skill development within the respective industry. So they're learning medical assistant, but and during the career development, what they're shaping up is how to be a good employee in the field. So you get all of those, as I said, necessary skills and what that looks like, a lot of workshops around that. And to sort of close up like I said, to wrap that, I guess, in a nice bow, if you will, one of the things that I'm probably most proud of is that we have the opportunity to have a licensed clinical social worker on site with us. And in that human development piece, what that looks like for us, most of our participants might look at this as it's a school advisor. But in that role, that person, again, essentially gets to help support those with barriers to employment that might come to a program like a CET, help them not only overcome and manage so that they can get into employment, but additionally sustain in employment. And what that looks like, not only are they working with them to support them while they're in the program, but they also follow them. So we follow our participants up to a year once they secure employment. And I think that's, for us, we've found that that's been one of the pieces where oftentimes participants, and I know Ruth on one of the slides was showing what the salary looks like. Oftentimes in our space, I'll get participants that might, they may be take advantage or have government subsidies at the time, but once they move into a job where they may be earning income such that their government subsidies might be reduced to some point, they now need to learn how to live off of just their income that they're getting from the job. And that can be difficult at some time. And so we make sure that we support them, not only, like I said, while they're in school, but up to a year in their job. So that hopefully lets us know if they can get into employment and stay employed for up to a year, then they're well on their way to sustaining in the role in which they're in. And Mr. Keaton, I'm going to have you to pick it up from here if you can. And Raina, please, next slide.
So, and I just want to be conscious of time too, because I know that Audrey has to also present. So,
Okay. Well,
so Dirk, I would say let's advance it. Take it, keep on going. If you can advance, Raina, to get to keep on going. Let's go to, I think, maybe here, and then Dirk, you want to pick up for the last two and share. I think the outcome slide is what I would like to get to. So the partners and outcomes, if you want to do that one, sort of. Go ahead.
Absolutely. And I'm Dirk Keaton. As they said, I'm the Data and Curriculum Manager at Some Center for Employment Training. And yes, we are affiliated with a number of DC government agencies, and that includes the Workforce Investment Council. And the WIC, as you may know, is part of what launched this health sector partnership, and that and not only did they help sort of facilitate our participation in the health sector partnership, but they have also used part of the funding from launching the partnership to actually fund 25 of our students through our program, which is very exciting. And so we launched that initiative in July, and we've been sustaining it through into the next year. We are also an OSSI, WIO adult and family education provider, and we're licensed by the Higher Education Licensure Commission. And we also work, as we mentioned, but with DHS as a SNAP employment and training provider. And this sort of wide variety of government partners allows us to offer these services at no cost to our residents. And it also connects us to things like DC Data Vault, where we can easily get referrals to and from our program. And we can advance the next slide. And we want to talk about, we all know last year was a challenging year, but we managed to have really, really wonderful outcomes. We delivered over 10,651 hours of e-learning and over 24,394 hours of instructor-led training in 2020. And that's grown even more in this year. So far, I've delivered over 49,000 hours of instructor-led training and about 10,000 hours of that software-based e-learning. What we've seen is, as we've been able to grow throughout the year, we've been able to offer even more and more instructor-led activities, which we know in a hybrid environment is really important to engaging students. Last year, the average wage of our employed graduates was about $17.50. 88% of our graduates earned industry-recognized certification. 100% of all the employed graduates who are participating in retention services last year remained employed for 6 months. 86% of these also remained employed for 1 year, and 84% of students, and these are the people because they're participating in that integrated math instruction where they're learning those math skills in their industry context, 84% of them managed to earn educational functioning level gains, which are equivalent to 2 grade levels of primary school or more in the past year, which is really significant because, like we say, we're a 6 to 9 month program. So that is a big gain in a long period of time, and I mean a very short period of time rather. And we'd love to share more of our program outcomes, and we'll definitely be able to field any questions you might have about it in the question and answer portion.
Thank you, Dirk. This is such a rich topic. I think we needed more time for this. Instead of an hour, we should have allotted an hour and a half because I know folks are eager to ask their questions. So Audrey, I'm going to turn it over to you and so that you can present. And let's cross our fingers that we have some time for Q&A.
Yeah, I was going to say, this is amazing stuff and maybe a little ambitious for the 3, but they fit together so nicely. I'm so happy to be here with you today because I think DCHA really set the scene. And while we're a very different program than some CET, overall, being like an adult charter school, I think it fits really well. So I'm just so happy to be here. Again, my name is Audrey Reese. I'm the Managing Director of Student Services at Academy of Hope Adult Public Charter School. And I was asked to talk about our healthcare career pathways, which right now we have certified nursing assistant as well as phlebotomy. Just a little bit of background about Academy of Hope. We have been a nonprofit since 1985 and a charter school since 2014. At this point, we have 2 locations. We grew from this teeny, a couple of volunteer teachers in a guard booth in an apartment building with a GED book and a couple of people who wanted to study for the GED, to this amazing program that we are now. We have 2 locations in Northeast and Southeast. We're offering our learners options to come in the daytime, in the evening. Now that we're still in a pandemic, but kind of returning, there's virtual options, on-site, hybrid. So it's been really exciting times over the past few years. Our mission, you can see it here on the 3rd point, provide high quality adult education and services that change lives and improve our communities. And as you heard, so important for us that if we're training somebody, that it's something that is in a high demand, high growth field. So it just fits. I feel like we're doing the right thing, just hearing what everybody's talking about today. And as part of this integrated and education training program, like they mentioned for some, we have core academic classes. We have 2 high school diploma pathways our students can choose if they are seeking a high school diploma to prepare for the GED exam or to earn their diploma through the National External Diploma Program. Career training is obviously what I'm here to talk to you about today. But within that, similar to some, it's a very supportive environment. We have student support services. We have career and college coaching. So it's certainly not just come in and do this class. What I am here to talk about today is sort of more of our certification level classes. So before I dive into phlebotomy and CNA, I did want to mention just kind of the scope of how we got into this work. So similarly to some, we are funded through OSSE Adult and Family Education. We were pre-charter and them kind of switching to funding integrated education and training programs. But that's a direction that we really wanted to go. So we were really excited when they started funding this kind of work. We first launched our career pathways in school year 18-19. So it really hasn't been that long. And we started out with hospitality. The next year, we added CNA as well as office administration. And then last school year, we kind of revised office administration. We made it we called it 21st century workplace, and we really added in this new normal. I was not on Zoom meetings really before last year much. So just really trying to prepare people for this new workspace. Last school year, we piloted phlebotomy in the spring, and that one I'm going to talk about today. And this year, we're actually adding an A+ certification, and we're considering additional things. We did a thorough labor market analysis last year, and we're really interested in just seeing what our students would be interested in doing. That would be those high demand, high growth, livable wage kind of jobs. And just to mention, right now, we're not doing all of these pathways. For example, in this COVID environment, hospitality, while we still have amazing partners, they're not really hiring new people. They're trying to bring people back. So we're being really mindful of making sure that we're training people for classes so they can go right into jobs. And of course, healthcare and IT are hot right now. So we're here to talk about healthcare. So I just wanted to dive a little bit into what we're doing for both of our healthcare career pathways, and then just tell you a bit more about them individually. So you had heard CASAS scores mentioned before. These are higher level certification classes. So we do have requirements of having a high school credential or being very close to earning one, as well as reading and math scores, computer, digital literacy skills. We have a recommendation requirement for our students. And as you heard with some of the other things, I can't say that I necessarily, or AOH, I'm a representative of AOH today, agree with all of these things. But because somebody's going in the healthcare industry, we are required to do things like a background check and drug screening and eliminate them if they test positive for any drug. And that, I saw was a question in the chat. So those are requirements that we have to have because we're bringing them to these clinical externships. We have an interview process too. Our healthcare coordinator does meet with everybody because we do want to make sure that the student knows what they're getting into and that they really have a realistic expectation and that we get to know them a little bit. Those CASA scores aren't exactly hard and fast. So while we do need people with strong academic skills to be able to handle the material, we want to have as much flexibility as we can. So what this talks about is mostly that you can have a waiver because we're a school and because it is integrated education and training, we have academic classes that our students can take. So we try our best to get them to still do the career pathway that they want to do, that term that they want to do it, and also build up their academic skills. Sometimes that can't happen. So sometimes we will talk to a learner and say, you would really benefit from an intensive term of academics, and then we'll reassess. It's not try once and you can never do it again. So we do hope, because most of our classes will offer twice in a school year, we'll hope that they can go into the next term because they'll qualify at that point. We also offer kind of a 101 level class. It's a really amazing class that gives the habits of mind to be successful, whether it's a job or college, whatever you want to do next. So sometimes we're recommending, if somebody really wants to get their feet into a career, maybe they're not sure yet which one they want to do, or they're not quite ready for these high level certifications, we might recommend that 101 level class. That's especially true when we have a high school graduate who doesn't quite seem like they're ready for that class, but they really want to get into this. So sometimes we are asking them to spend a little more time with us to make sure that they're as prepared as possible for the level of work that they'll be asked to do in those career pathways classes. And so if somebody's interested in healthcare, they currently have two options to choose from. This is just about CNA. I think this audience probably knows, but we always tell our learners kind of what a certified nursing assistant does, and that they'll be sitting for the National Nursing Assistant Assessment Program examination if they successfully complete. We're offering certified nursing assistant right now at our Ward 5 location, and we have a daytime and an evening section. So I did see a question in the chat about if somebody has to work, and that's absolutely a reality. So we try to fit somebody's schedule. There's also, obviously with these, this hands-on skills. We haven't found a way to do these completely virtually, but we are as flexible as possible. There's sometimes where there's work that somebody would do from home. There's a lecture that they might come into through an online meeting like this. So try to eliminate some of those barriers to always coming on site. As I mentioned, when we piloted this in the fall of 2019, these are just some of our outcomes. We had 3 learners who finished and 1 who took that certification exam. Then in the winter of 2020, COVID hit before we finished. So we had 8 learners doing really well in that cohort, and only 4 of them so far have been able to come back and finish out their clinical work. But then all 4 of them did sit for the exam. And then last school year, we had 2 cohorts. It was 12 learners total who finished, and so far 10 have tested. And so that's 15 learners who tested, and all 15 have passed. We're so proud about how many people we've certified and how many jobs people have gotten. And then the last thing I wanted to mention here is that we are working to expand to our Ward 8 location. We want to make sure that this class is available to anybody who wants it. And of course, somebody whose home site was Ward 8 could come to Ward 5 and do this class, but that's not always convenient for somebody. For CNA, we did have to build out a healthcare suite. We have this whole mock hospital room in our school building. And it was easier at Ward 5 because we have a larger space and we own that building, but we just did a renovation at Ward 8. And we're really excited. We are very close to getting funding to be able to build out that healthcare suite. So stay tuned for that. Similar to, I think, what you heard, there's a lot of programs out there that have a lot of fees or hidden fees. We are very clear that there is no cost for any of this to the student, which is really important to us. Also, as part of that grant, we're able to offer some incentives. Within that, even if somebody doesn't get quite as far as getting that certification at the end, there's embedded micro-credentials. So somebody could get CPR and basic life support, even if they don't end up finishing. They have the externship. As part of our career coaching, we work with every student to have a career portfolio. So a resume, to have a LinkedIn profile, all these things that are really important to help them get a job. And then we help them interview with employers. So we don't go quite as far to say that we guarantee a job, but we have some amazing employer partners. You can see some of them at the bottom that are very willing to hire our graduates if they're qualified, and they are qualified. And obviously a benefit is becoming a certified nursing assistant. So finally, our new pathway, phlebotomy. Originally, I was asked to talk about CNA, but I also wanted to mention phlebotomy, and everyone was gracious enough to let me, because this one we found has been really good because it's so portable. So we were able to start this at our Ward 8 site because you don't need a big suite set up. We're also finding that it's maybe not quite as intensive as CNA. And if a student starts in phlebotomy and then they decide to do CNA in the next term, they can become a patient care tech. So they can actually go in at a higher level with some additional skills. So this has been a really great addition. Some students are doing this as a standalone and some want to do it in conjunction, but they wouldn't do it at the same time. That would be a lot. I think we probably know what a phlebotomist is. Don't look at the pictures if you feel a little squeamish, but phlebotomist would take the blood sample that would be so important to somebody to get the right diagnosis and things like that. And then our students would sit for the NHA phlebotomy technician certification exam. As I mentioned, this is currently at our Ward 8 location. Again, we have a daytime and an evening section to fit students where they are. And we just had our pilot where we had 7 learners finish. They did their coursework until late May, and they did their externship work in June, and then they started testing in July. So we haven't had everybody test yet, but 5 of our program graduates are currently certified from that pilot group. Very similar benefits in the sense of, since it's under the same grant, we can still do the same incentives. We can offer the same micro credentials, but obviously in this case, their externship might be at LabCorp because they can do a lot of blood draws there, but they'll still do the same portfolio. We'll still set them up with interviews, but obviously in this case, they're looking to become a certified phlebotomy technician, or in the case of doing both, it could be a patient care tech. So I know we're going to go into like hopefully a bigger Q&A. I can't see the time. Oh, I don't know if we have time, guys. But this is my contact information. I'm also here on behalf of my Director of Career Workforce and College Services who couldn't join us today. That's Mary. So please feel free to email us if you think of any questions or comments later.
Thank you, Audrey, for that speed round. I want to apologize. I have to put you under that pressure to kind of run through your slides. And I just appreciate everyone hanging on. Ruth has adjusted her schedule, so she will entertain questions. So for those who are able to remain for a few additional minutes, we do want to make sure that if there were any burning questions, that you have an opportunity to pose them to our guests. I want to thank them for a wonderful, really informative presentations. I'm not going to take up too much time, so I'm going to just turn it over to folks who have questions. I believe there was a question from Melissa Myler around behavioral health. Let me see if I can find it. And if you can unmute yourself, Melissa, you can also ask that question as well. And I think the question was directed at Ruth. And this specific question, bear with me. Will there be further efforts to identify behavioral health related career paths, including looking at peer support workers and community support, community health workers, and pathways for them to advance?
Yeah, thank you for that question, Melissa. I will say that absolutely the partnership will continue to look at additional career positions based on the industry needs, and because behavioral health is a part of one of the key subsectors, we absolutely will. I can't necessarily commit that it will be peer support workers and community support, because it really is driven by what the industry says are the highest growth, high demand, and sustainable wage positions. So, we will continue to look at respective positions.
Great, thank you, Ruth. So the next question was from Nicola Reed. She wants to know what efforts and or programs are in action for people looking for employment. What is the process for accessing these programs for employment? So some more context probably would be helpful for this question, but I'm assuming that she may be referring to once folks have completed the program, how are they being placed in employment? What's the, and I'm assuming that this question is also directed at you, Ruth. Is there some consideration that's being made in terms of how you're approaching this work to make sure that you're actually connecting people to employment opportunities?
Yeah, thank you. So the partnership itself is not a connector directly at this point, of the resident to the employer. That is likely more of the training programs. What we're connecting and creating are we're seeking to develop the pathway system that will help ensure that we're building that talent pipeline for the district resident. So I would probably punt that over to Dirk or Veronica or Audrey in the sense of you have direct training programs. The partnership doesn't have direct training programs. What we do though is that we want to make sure our healthcare employers have commitment to hire.
Do you want, one of you want
Yes.
to take, just one of you take that question?
Yes, I can add to that. So yes, while we have training programs, I think that is part of at least the work that we do. And we get to do through this partnership is that folks come into the facility for training, but also have the opportunity to network. On ours, we do like what we call an internship, externship. So participants get to go from the intern, in cases, again, for us, pie in the sky would be the participants go from the internship, externship, and they go right into a job within that facility or with the partner in which they've been working with. But I would say definitely opportunities. And I believe with most of the other, some of the other training programs that's within the partnership, sort of the goal is the same.
So this is a sequel, and I think it was touched on in the presentation, I believe, by Veronica. But this is in regards to, as folks are going through training, how do they sustain themselves financially? Can you talk a little bit more about that? Because I know that that's often an issue and a challenge for, or barrier for individuals that say, I need to work, but I also am trapped in a job that, you know, and I want to pursue some training or upskilling.
Yeah, I would say that those who come to us, in many of cases, probably by and large, we have more that are, like you said, not employed. So a couple of options that we have for participants who say, hey, I can come and participate during the hours of the day for your program, but I do need to get something to sort of help me continue to get by. First, I would say, because we're fortunate enough to fundraise and scholarships, so we take care of the cost, any and everything. We provide them $100 a month, smart trip transportation to get to and from school. If they need scrubs or whatever it is that they need, we try to take care of that so they don't have any cost out of pocket during the time they're in the program. So that's sort of one. But additionally, we have what we call our staffing consultant would assist them with what we call a survivor job. And those are jobs without partners that allow them to work during the hours that might be after the school, but it allows them for some type of part-time employment to hopefully be able to, like you said, continue to eliminate the barriers so they can continue to successfully complete the program and then get into the employment opportunity that they want or of their choice. So I think that's at least, hopefully that answered.
Thank you. And Audrey, do you want to chime in? Is there anything that you're doing in particular to support or help the students or folks who are coming through your program around this issue?
Yeah, I mean, very similar stuff to what some said, so I don't think I need to add on to it, but same,
Okay.
you know, adult learner transit subsidy, jobs in the short term, the same kind of stuff.
Great, thanks. So Marty asked a question about around background checks. Are residents with past criminal backgrounds, either misdemeanors or felonies, categorically excluded from employment in these positions?
So I would say in our experience, not entirely excluded. I would say we do pull a background check for all of our participants. Again, it is not as part of admissions to the program, but it's designed once they successfully enrolled in the program, that career readiness part of that course for them is to assist them with how do they talk to employers about what's on their background. I think one of the things that we often find is that in the district, many residents might have more arrests on their records versus, or may have more like something that's a charge is not necessarily arrest. And employers, I think working with employers to help them understand how do you read a background report. So if I got 3 pages of a charge, but it wasn't a conviction, that shouldn't be on my background. So I think helping the employer understand how do you read a background report, but for the participants, helping them to understand how do you talk or speak to an employer about what's on your background report. It can be challenging. But when we build the relationship, our thing is to bring the employers in. I think oftentimes when the employers come into our space and they get to see our medical assistants in the lab doing the work, it eliminates all of the things where, you know, if they were just applying and their resume have to go through an algorithm and then someone is going through that, you get to see this participant skills and what skills they are. And you can see, hey, I can really have a good, viable candidate for a position and not rule them out, even if they have a background. Again, we know that. So key being training programs, making sure that we are partnering up with the employers. And then, as I think Ruth mentioned, holding the our employer partners accountable to saying, hey, yes, I am going to employ these people. So it takes that relationship and for employers to understand. I think there may be some hard nose with some of the stuff, but I have seen participants who successfully, with a background, get employment in the healthcare field.
Ruth, can you talk a little bit about how the partnership is approaching this issue? Because I know it's a big one.
Yeah, it is. And thank you, Veronica. I would absolutely agree. And I would say, if you remember in the recommendations, what we had the piece about the advocacy and the education, that's one area where we have several partners that are involved with, persons who are returning citizens or just as involved, and really hearing from them, as well as the employers, again, as Veronica said, helping them to understand how to address this issue, read background checks, because it's sort of, some of it is industry specific, and we need to address that at the industry or subsector or even service delivery level. For example, at a pediatric hospital, there's certain convictions. It's likely you can't be employed there. So we really want, from the partnership perspective, is to look at these policies and identify which of them, some of them are really outdated, and how do we bring them, to the, using that 21st century, how do we bring them to the 21st century, recognizing some of the systemic racism and injustices that have been in our system that have caused our residents to have these respective convictions unnecessarily. So we really want to take a deeper dive in that. And I'll just kind of push to the question about, so what's happening in the partnership in 2022? We're really going to be on focusing on that shared agenda with action teams that several here are involved in, that are helping to bring forward what the strategy should be as we look at these 3 priority areas and moving that work forward around advocacy, around understanding the pathways of these healthcare employers and healthcare workers, and making sure that we really start moving into alignment. But again, addressing these major barriers that we're having to workforce that need to be addressed at the licensures level, at training, and at the employer level. So that's some of the work that's going to be done in 2022, and encourage those to get out and be involved in the action teams. They're not limited to partnership members.
Okay, thank you so much. I want to be respectful of folks' time. We really do thank you for hanging on with us. Ruth, Audrey, Veronica, and Dirk, we thank you for a really enriching conversation. This is really a topic that we need to continue to explore. And so we are open to kind of continuing to work with you moving forward. We thank you for your time, and we thank you for the great questions, and for the folks who joined us today. We will be sharing the presentation, the slides, and you will also have the contact information for our guests. So if you want to follow up with them individually, we encourage you to do so. And so we'd like to close out and thanking you for your time, and thank you.
Thanks so much.
Our pleasure.
Thank you all. Bye now.
Take care.
Take care.